Multi-tiered systems of support foundations. Throughout this lesson, we will focus on the definition and history of multi-tiered systems of support, as well as how MTSS aligns to the state and federal guidelines. According to the definition in the Every Student Succeeds Act, multi-tiered systems of support is a comprehensive continuum of evidence-based, systemic practices to support a rapid response to students' needs with regular observation to facilitate data-based instructional decision-making. So MTSS is a systemic framework with prevention and intervention, uses evidence-based practices, data-based decision-making, a continuum of support, and teaming and engagement from stakeholders involved in the school system. Tiered supports is not a new initiative, buzzword, or practice. Tiered supports started in the 20th century as a means for the public health sector to improve health and quality of life from a prevention approach. It is derived from the multi-tiered public health model, developed as a cost-effective means to improve health and quality of life for prevention and treatment, places an emphasis on addressing the health needs with limited resources, effectively reduced mortality rates in the 20th century, addressed multiple health goals for large groups, with universal health practices for all individuals. When we look at this using the public health model, the tiered system looks like this. Tier 1 is services developed to prevent a particular illness from occurring. Tier 2, services for those at an increased risk of getting the illness. The goal is to reduce the chance the individual will get ill. And Tier 3 is to lessen the effect of the illness or cure if possible. Let's look closer at Tier 1. This is primary prevention. Everybody, 100% of your population would receive Tier 1 services, but about 80% of patients would respond to Tier 1 prevention. For example, you go to the doctor for your yearly physical and you tell the doctor you haven't been feeling well. You're a little dizzy, you're concerned about your blood sugar. Enters the primary prevention, or this Tier 1 level for all. The doctor talks to you about your family health history, does a blood test to check for diabetes, educates you on what diabetes looks like in the body and how you can prevent high blood sugar, encourages you to go on a healthy diet, exercise, and asks you to monitor your blood sugar daily. At the secondary level, let's say you go back for a follow-up and you have done all of the things the doctor asked and educated you on, but your blood sugar continues to stay high, so the doctor introduces you to a secondary treatment. The doctor says some patients respond to this medication or small dose of insulin in conjunction with all of the things that they are continuing to do. Plus, the doctor says, I would really like to recommend you attend a few classes on how to manage your diabetes. 4 to 6 weeks later, back to the doctor you go. You and the doctor notice that you are still seeing extreme spikes in your blood sugar and you are needing more dosage or services to support to help you control it. This is where Tier 3, or that tertiary tier, enters. The doctor and you recap all the prevention and treatment intervention that you've been doing throughout Tiers 1 and 2. And you've been exercising, eating healthy, taking meds daily, but your body is needing more to combat the blood sugar. So the doctor recommends you seeing a dietitian weekly. He sends you to a specialist to see regularly and prescribes daily insulin injections or maybe even an insulin pump to help your body control the blood sugar. You are still seeing your primary care physician, emphasis on the primary at the Tier 1 level. However, you are also layering on these other necessary treatments to regulate your blood sugar. This does not necessarily mean you need this level of support for your blood pressure or cholesterol. Let's shift our focus to multi-tiered systems of support and Oklahoma education. Throughout this lesson, and then lessons at the beginning of Module 3, we will focus on best practice models using supportive positive school climate in Oklahoma education and how to identify how these approaches align and integrate to build a strong systemic framework. Here is the triangle that we looked at when we were looking at the public health model. You'll notice at Tier 1, this is the universal practices that are experienced by all students and educators across all settings to establish a predictable, consistent, positive, and safe climate. Tier 2 are targeted practices that are designed for groups of students who need more structure, feedback, instruction, and support than Tier 1 alone. An individualized tier, these are interventions set up to meet the challenges of students who need more support than Tiers 1 and 2 alone. Take a moment to read through this slide. You are seeing tiered frameworks for addressing the needs of the whole child for academic supports, behavior supports, and social emotional supports. You can see that for each area, we have set up individualized, targeted, and universal supports. To support stronger mental health and support for all students, trauma-informed elements and stakeholder engagement should be infused across all tiers and across all domains. The social ecological model is used in prevention and for identifying social factors to the person within a setting. To start a climate shift in your school site or district, you would need to address at least 3 areas in your plan. To obtain a complete climate change within your school site or district, all areas would need to be addressed. Let's take a closer look at these. Individual puts the focus on an individual's knowledge, skills, behaviors, and beliefs. Relationship focuses on interactions between peers, family, staff, and social networks. A school-wide focus is on the social environment, school climate, and culture of the system or organization. Partnerships with community agencies and resources, norms, values, beliefs, and attitudes of community organizations and members. And then state, federal, and district policies. So policies and laws that impact practices in the school system and district policies that impact the student in the school environment. So as I was saying, when I showed you the SEM model, that you would need to address 3 of these to start a climate shift, but you would address all 5 areas for a full climate shift. So at the, let's say we implement, multi-tiered systems of support, and we put in PBIS to help address behavioral concerns at our site, we would want to make sure that our policies align with our trauma-informed PBIS policies so that we have consistency across our school building or across our district. The PBIS, or Positive Behavior Intervention Support Model, addresses the critical features of practices, data, and systems. We use data to inform an action plan to build refined systems and practices which support data-based decision-making. These 3 critical features work together to promote positive, predictable, and safe environments for everyone in all school settings. When schools implement school climate transformation through MTSS, they start by implementing it school-wide. This allows consistency and positive climate across grade levels and throughout the building. There are 3 critical features to a successful framework implementation. The systems that are the keystone feature and ensure sustainability. The best practices support all students' academic, behavior, and social emotional learning. and the data that drives decisions and guides the problem-solving process. Again, these three critical features work together to promote positive, predictable, and safe environments for everyone in all school settings. Remember, positive interactions, predictability, and safe environment are all aspects of positive school culture. This is an example of the PBIS model for Tier 1 implementation. This framework will fit nicely into an MTSS tiered system. We will look closer at each piece of the framework throughout the lessons of this module and in Module 3. Here you can see the model framework for OTISS, or Oklahoma Tiered Intervention Systems of Support. The active components are universal screening benchmarks, tiered levels of intervention, progress monitoring, and decision making. The support components for OTISS are leadership, teaming, professional development, and family engagement. Both models are a tiered approach. One has a greater emphasis on academic response and the other behavior and emotional support needs in the school system. As people, organizations, agencies have developed their own components to better describe what goes on into building an effective and sustainable model of MTSS. For Oklahoma, they have identified 8 core components, which can be thought of as active and support elements. The active elements are the things you see in the triangle. They are the tiered interventions and the database process for identifying levels of needs and resources. The support components are what stands behind the triangle and keeps it going. They are the structure. Behind every triangle is leadership, teaming, professional development, and family engagement. Another way to view this is through the lens of what surrounds the triangle to keep it standing. In the PBIS world, they have defined this as practices, data, and systems that support the tiered process. A more expanded view of the tiered process shows us the individual components and permanent products that are built as an education system implements this model. As you can see, the data is used to inform the action plan to build and refine the system and practices which support database decisions. However, defining it this way does not neglect the components that are outlined in OTISS. In fact, they overlay quite nicely. Leadership and teaming are part of the systems. Tiered interventions are part of practices. Decision-making, progress monitoring, and universal screening are database decision-making. And professional development and family engagement are part of the trainings that need to happen on the practices and data with everyone, including families. This is just a visual infographic to show you the information that was laid out on the previous slides, that both frameworks fit nicely into that SEM model. As we will go further into social emotional learning in upcoming lessons throughout Module 2 and Module 3, we will look closer at the 5 competencies for social and emotional learning. Your social emotional learning curriculum or prevention planning will also align nicely into your MTSS framework. This is what it's like when all the models align and initiatives are built together in a meaningful way. We have a school within the community and state that motivates learning and strong educational outcomes because it is supported through a strong school climate. The initiative should align, which means they complement additional evidence-based practices implemented by the school. Practices should be integrated in such a way that the practices together build a strong supportive system that is parallel. In this example of the framework, we see each board plays an equally important part in the structure and contributes to the overall outcome of building a well-supported school climate. You will find linked in on this presentation and also below this lesson positive behavior interventions and supports. This takes you to pbis.org where you can learn more about this framework. We have provided you with a copy of our framework that shows the systems, practices, and data. We've provided you with information to read more about OTISS, and we've provided you with information this will take you to castle.org to learn more about social emotional learning.